Hello, everyone, and welcome to today's session on the evolution of emergency management in a post-pandemic world, hosted by Women in International Security's Emergency Management Task Force. WIIS is the premier organization in the world dedicated to advancing the leadership and professional development of women in the field of international peace and security. My name is Kit Lee Demery, and I am the manager of business continuity for the international law firm Proskauer Rose. I am also the chair of the WIIS Emergency Management Task Force. The task force is dedicated to bringing professionals in emergency management and security backgrounds to establish a network that fosters relationships and risk intelligence information sharing. So if you're interested in joining the task force or WIIS Global after this event, please email WIIS-NY@wisglobal.org. We are so excited to bring you this webinar today. This webinar will be recorded and will be available to you on the WIIS Global event page. If you have any questions for our wonderful panelists, please submit your questions in the chat box at the bottom of the screen, and we will do our best to answer all of your questions at the conclusion of the event. Today, we have some remarkable guest speakers for you. I am happy to introduce to you Amber Green from Port Authority of New York and New Jersey, Mike Lee from the Metropolitan Transportation Authority, Craig Biscuit from New York Presbyterian Hospital, and Katie McDermott from OBrien and Kim. Panelists, if you all don't mind, we would love to hear a little bit more about you. We'll start with Amber, followed by Mike, Craig, and then Katie. On to you, Amber.
Great. Good afternoon, everyone. Thank you so much again to Kit and the entire WIIS team for having us here. Looking forward to learning from everyone and hearing some more about the information the other panelists are going to share today. As Kit mentioned, I'm Amber Green. I'm the Deputy Director for Corporate Communications and Media Relations for the Port Authority of New York and New Jersey. Those of you that don't know, the Port Authority is a bi-state agency that builds, manages, and operates our transportation infrastructure, ranging from our airports, our bridges and tunnels, our rail system, port, and also the World Trade Center campus. Prior to joining the Port Authority, I spent my career working in various fields related to policy and communications for various state and local entities, as well as New York City Office of Emergency Management, where I spent the bulk of my career and got a chance to know many of the folks here. So big shout out to all OEMers past and present. When I was at OEM, I ran the city's emergency preparedness campaign called Ready New York. And there I developed a lot of initiatives related to making sure that people were prepared for emergencies, especially our vulnerable populations. So from seniors, people with disabilities, our children's preparedness program, all ways that we could work together to be safe. And then obviously responded hand in hand with folks to various emergencies that were on a larger scale. And we were actually writing about pandemics before they became a thing. So we had a lot of information there, and I'm also a former consultant to FEMA's Risk Map program, where I worked with Region 2 on outreach and engagement. And lastly, as a volunteer, I work with my church and work on basically transitioning from in-person worship to a totally virtual church. So that has been an experience. So thank you again for having me.
Thank you, Amber. Mike, you're up.
That was kind of tough to beat, to be honest with you. But most important, thank you for WIIS to be having me, and thank you for putting this together. Right. My name is Mike Lee. I'm with New York State Metropolitan Transportation Authority. I am actually as part of the, for those of you who don't know, Metro North encompass New York City's transit, Law and Railroad, Metro North, the commuter railroad, bridges and tunnel, and also the construction development group. So I'm actually the director of CCTV and drones, a remote system on the MTA headquarters office of security. Bit of a new role for me. I just started maybe about 2 months ago. Previously, I was actually with the commuter rail, Metro North, as the assistant chief officer of security technology and project. What it boils down to really is that for the past 7 to 8 years, I've been working on planning, configuring, designing, and deploying electronic security technology across the commuter railroad. And look forward to hear from each of you panelists, and also some of the questions that the attendees have to share. Thank you.
Thanks, Mike. Craig?
Good afternoon, everyone. Again, like everyone else, thank you very much for having me. I'm very honored to be here. Craig Biscuit. I am the supervisor of emergency preparedness for New York Presbyterian Hospital. We are an 11 hospital healthcare facility that encompasses the 5 boroughs in Westchester County. A little about myself. I am a New York City paramedic. I still practice in the field. I've been a paramedic since 2001 and an EMT since 1992. I worked at the New York City Fire Department before I came to New York Presbyterian. In 2014, like a few of us here, I went over to New York City Emergency Management, where I worked as a watch command supervisor. And I was able to bring that experience back to the hospital and start our intelligence gathering work. We rely very heavily on several platforms, Data Miner, NC4, Breaking News Network, in order to gain a good grip on what's going on outside of the 4 walls of our hospitals. The way we look at it is there's nothing that goes on in the 5 boroughs that doesn't in one way or another impact the operations of our healthcare facility because of such a large footprint that we have. Emergency management is what I do. So here we are. And again, thank you very much for having me.
Thank you, Craig. And Katie.
Hello, good morning, good afternoon, good evening. Thank you so much for inviting me. My name is Katie McDermott. I'm our hospitality manager for OBrien Kim, also our director of communications for WIIS Emergency Management Task Force. I've been with OBrien Kim for over 11 years in various client services and business continuity capacities. I manage our OBrien Kim's internal events, green initiatives, and global celebrations. I partner with departments to curate initiatives that support small, minority, and women-owned businesses to foster a sense of community within the firm and around the globe. Throughout the pandemic, our corporate social responsibility initiatives aim to support these small businesses and area hospitals while sending gifts to our employees. I leveraged my business acumen by collaborating with office managers and business leaders to create and execute office-specific business continuity plans to minimize impact during any disruption. In my current role as hospitality manager, my close working relationships with my colleagues throughout the firm have bolstered OBrien Kim's substantive business continuity expertise. Over to you, Kit.
Thank you. Thank you. Thank you. Thank you. Thank you everyone so much for being on this panel. We really appreciate you taking the time to speak with us today. I will now introduce to you Katie Fisher. Katie is the Grant and Stewardship Manager for CARE, and also she is the co-chair of the WIIS Emergency Management Task Force. So take it away, Katie.
Thanks, Kit, and thanks all to you all for joining us today. We really appreciate having you here, and we're looking forward to hearing about your diverse backgrounds and experiences. So our first question that we wanted to ask was, how did your organization and/or your industry evolve both positively and negatively from in the emergency management perspective throughout the COVID-19 pandemic? And do you expect any further evolution in the future? Amber, why don't we kick it off with you?
Great. So like most on the call, we evolved very quickly. It was pretty much overnight. I actually joined the agency last summer in 2020. I interviewed probably about a week before everything shut down. And so it was really intense, as most people, experience. Everything was online. Everything happened very quickly. 2/3 of our staff had to continue to go to work because our airports, bridges, our tunnels, none of those things were closed. None of those things ever shut down. So for us, a lot of people had to make sure that they had the correct, PPE, and getting that early on was hard for so many people. Making sure that people felt safe. And I'd say the one takeaway that I, have taken since joining the Port Authority is really the importance of making sure that your staff is taken care of so that they can get to work and do the job to help other people, specifically in the emergency management field. So a lot of that was focused on internal communications, making sure that people had what they need. If they needed flexibility, to care for a relative or a child or just different things that were happening, those were really key at the outset and have continued throughout the hopeful, end to recovery that we all want so badly, have continued. From the external standpoint, I'd say a lot of our communication came from different sources. There were so many things that were changing. One day it was do this, one day it was do that. And so it was really being flexible, but understanding that we had to make sure that we were communicating with our customers, very succinctly, providing the information that they could use, providing that information to media so that they had that information as well to get, the right directions out, which people doing when it comes to mask wearing or how you're using facilities, and making sure that people really felt that we were doing a good enough job to make sure that we had enough cleanliness and all the things that matter when it comes to running a safe transportation entity that we are. So for us, it was really big focus on internal comms so that we can make sure that our people were taken care of, and then externally trying to also ensure that we were providing really timely information and accurate information as best as we could.
Thank you, Amber. Over to you, Mike.
Thank you. So as you guys can imagine, being the MTA, being the engine that drive New York and the region area, right? It was a very big sudden change to suddenly say your prime business is moving people, but people just stop moving, right? From a security technology standpoint or immediate to my work, luckily on the technical background side, the changes are not as dramatic, but every one of us all of a sudden have to stop and rethink every way how we do things, the process, the methodology, right? There need to be an element missing now, which is that face-to-face, as much as we want to say like, the generation is very electronically savvy and very good at technology, there is still adjustment for everybody. And I think on an immediate sense is that everything has to be adapted quite quickly. I heard someone once upon say like we're sort of just flying this airplane and building at the same time. Everyone is just learning as it goes. And I wouldn't say positive negatively. I think a lot of practices and a lot of changes are driving us to go back to the new normal, whatever the definition of that is. And I think some of them are really good, like more remote meetings, right? More effectively, less paper, more of an effective workflow of like transferring files back and forth, so on and so forth. So there's some good things coming out of it. The negative really is just the fact that the amount of life lost, right? And just this drastic change in the mindset of like, every event like that, kind of changes everyone's mindset forever, right? Now everyone's very conscious about when you even cough a little bit on a train, right? So that would be some of the takeaway that I experience and I see.
Thank you, Mike. Craig.
Thank you. That's a great question because COVID has impacted everyone, regardless. It didn't matter what industry you were from, whether it was transportation, the Port Authority, or the MTA, or in healthcare. I mean, healthcare got walloped. And I really don't know any other way to say it. And New York Presbyterian was no different. Healthcare adapted very, very rapidly because of how COVID ramped up as quickly as it did when it started. You hear the phrase 0 to 60 in 2 seconds, and I think we did it faster than that. We went from 0 to everything, really. I think that everything we did was positive. And I say that because we have nothing to compare it to. In the weeks leading up to COVID, similar to Amber, we were doing pandemic flu tabletop exercises with our staff in different departments. Never knowing that we were ever going to experience what we did. And I never saw this coming, to be honest with you. I think that a lot of people thought the same thing. But we got destroyed really, really fast. Amber mentioned communications, and I can't stress enough how important communications is, especially in healthcare and dealing with a pandemic. There are questions asked, oh my God, what do I do? Do I go home to my family? How can we manage that? And that was a big thing. It didn't matter whether you were in the environmental services department. It didn't matter if you were a nurse or a physician or an EMT or a paramedic. In dietary and nutrition, it did not matter. Once we were exposed to this, how did we respond to it? And how did we live our lives during it? One of the things that New York City OBrien did, and some of the things that we did as well in the healthcare industry, was provide people with hoteling options so as not to be able to go home and pack their families. And a lot of people didn't even have that option. A lot of people had to go home. They didn't have a choice. People were sleeping in their cars. or at work in a locker room. So I think that the biggest impact that we saw was having to improvise our lives in every aspect. The other thing that was mentioned was the availability of PPE. And at the onset, no one knew how to conserve it. Where are we getting our masks from? We're competing with however many other agencies, and not just healthcare agencies, but Port Authority, for example, the MTA, the hospitality industry. We were all in the same boat trying to get the appropriate amount of PPE and the appropriate type of PPE. Because again, COVID evolved very, very quickly. The CDC would give guidance on Monday, and on Monday night, the guidance was completely different because we were learning and it was ever evolving. And, again, the positive and the negative, I think, were together, but I think everything we did was positive because we learned from everything that we did. And that's the biggest thing in emergency management. When we do an after action report, and that's exactly why we do an after action report, is we learn, we discuss, we learn, and everything in emergency management is based on what we did yesterday and how we can apply that tomorrow. And I preach that. Communications was huge. Again, we had to take what was being said from the outside and translate that to a certain extent so that people could understand exactly what they were saying. Not everyone knew what Dr. Fauci was saying, as plain language as he tried to be. And I commend him for that. But, a lot of people just didn't understand what was being said, and it was changing so frequently. So I think that was one of our biggest challenges, was trying to keep up with the flow of information and on the type of schedule in which to disseminate that and who is the appropriate audience and things like that.
I can just chime in real quick. And, you all just raised some really great points, especially with communication also. There's so much rumors, so many rumors are out there that you don't even know what's real and what's not anymore. And what are your reputable sources, right? And how do you know if someone is saying something that's accurate and that's what it actually is? Especially during the beginning of the pandemic, so much isolation and quarantine, and especially, those who are first responders or essential workers who can't go back home or fearful to go back home, just like what you were saying, Craig, that mental, that affects the mental health, right? And being able to take care of yourself and your own family, but worry about getting other people sick, but trying to take care of all these patients and even your colleagues and all that makes it really difficult. So I commend all of you for the work that you do.
Katie, you wanna speak to the evolution and from your perspective?
Yes, thank you. So I look at the evolution of our emergency management in 6 phases. So the first phase in March of 2020, our pandemic action plan documented what we thought we would need to address based on the stages of the pandemic for the next 14 days and what was already handled by each department. And that led us to provide leadership with 2 decision points on the next course of action. By phase 2, I created a pandemic response plan that documented what each department would handle during every phase of the pandemic. Phase 3, I created a pandemic report that focused on key metrics for each office manager to report out weekly. And our operations team could easily report on key trends to senior leadership. Phase 4, I built a global return to operations dashboard that defined our decision escalation process, 5 phases of RTO that assessed readiness of our communities, facilities, and employees. And it also showcased positive cases and vaccination rates worldwide, real-time completion percentages of RTO office checklists, and leadership firm announcements. By phase 5 and 6, I collaborated with our people and comms teams to create office visitor manuals. And we pivoted to create a return to operations manual that addressed our firm's stance on vaccinations, wearing masks, social distancing guidelines, and hygiene measures. So really what the trends that we're seeing are business disruption manuals will now be split into a preparedness plan and an action plan, smaller grab and go plans that really define what is needed based on the phase of the disruption. And how do we thoughtfully connect with employees with a change in the office culture? The typical work environment now includes hybrid environments. So that's what we're focusing on now. Back to you, Katie.
Thank you, Katie. Really interesting. I'm curious to know if each of you could share a bit about what your most important or biggest resource was throughout the pandemic. I know we're still in the pandemic, so something that you've been utilizing throughout this time. Amber?
So many things I could think of tangibly of, my laptop, my cell phone. But I think most importantly, it's been the ability to develop, what I would say, interagency and intra-agency relationships. And to me, that was key, especially to someone that, I didn't know anybody. I wasn't in the office. The first time I went into the office was like September 11th, like last year, for the 19th anniversary of the attacks. We went into the office. That was the first time I had met many of my colleagues. And so when you don't have that face-to-face communication, when you don't have that ability to connect with people on a more personal level, you really have to rely on, obviously, technology to do so. And being able to build those interagency relationships were key to me getting information timely, making sure that I could connect that information back to reporters as well. Because, for the most part, if someone who doesn't know you, they'd be like, forget it, I have other stuff to do. Everybody has different priorities. So it's really important that, we're being active listeners, in our daily work to figure out like, how can, what is this person dealing with that I need to also be cognizant of when I make a request, giving people enough time to, when you actually make a request to someone, so that you don't always have to, constantly come last minute, because I don't like last minute, and I know other people don't when I ask them. And I think that has helped me to build the relationships that I need to get information out there externally by doing some of those things.
Thank you, Amber. Mike, from your perspective, what's your biggest resource?
Well, first of all, personally, I think I appreciate the biggest resource. Everybody in the industry and everybody that had to suddenly adjust and juggle the remote work, where we all become, part teacher, part babysitter, part worker, at all time, and the amount of stress that go into everybody, all times of the day. And quite frankly, like you said, we're still in a pandemic. I appreciate a lot of the leaders in our company, in a lot of regional and a lot of industry, where you guys have to undergo giving 2 years worth of bad news every single day, right? I don't think we have too many good news. It's just been bad news after bad news, and to be honest and to be upfront about it, right? But in a more immediate to my work, I can thank, I guess, the IT department of all the advancement of IT technology, where the Zoom, the Teams, right? And more importantly, a little bit about security, right? Touching upon it, the cyber security that come along with it, making sure we can do it without compromising our data, right? And just to dovetail back into what Amber was saying, is that the interagency connection suddenly become a lot more tighter over time, because in terms of deploying technology or product, there isn't that margin of QA or some research. So it rely a lot onto talking to some other agency. Hey, have you deployed this? Have you not deployed this? Was this effective? Was this not effective? Because information overload. There's just so much information. Everyone suddenly is an expert on this overnight, all of a sudden, and everyone have a solution for you, right? That was one of the biggest resource that I identified through this period.
Thank you, Mike. Craig?
So I gotta say, kind of a twofold answer, honestly. I think for most of us, our biggest resource was our families. For those of us that couldn't go home, or that were stuck at work doing ridiculous hours, the support that our families gave us was just tremendous. And, Kit, you mentioned the mental health aspect before, and the impact that healthcare specifically has felt from mental health, physician suicide, provider suicide, things like that. And again, NYP is no stranger to that. We unfortunately experienced those things. But the support that we've received from both inside our facility, from leadership, from the executive leadership, from our peers and our co-workers on down, it was just tremendous. On the other side of that, collaboration, which has been, I can see that being the trend here today, and innovation. One thing that we learned is that regardless of what our title was, whether you were a senior vice president or you were the guy sweeping the floor, it didn't matter. You were on the same team. It was that simple. Didn't matter what your salary was or what your title was. You stood together, you stood the line together, and we worked together. And that led to innovation. People learned a lot. And, Mike, you spoke about everyone becoming, experts overnight. And, I can see that did happen, but we were able to lean on each other, to learn from each other. And that allowed us to come out of our roles and to step into roles that we weren't normally responsible for on a day-to-day basis. For myself, for example, supply chain, something that I knew about, I knew what it was, but getting called into work at 10 o'clock at night to deliver these demystifier units was not something that I was ever accustomed to, or having to come to work on a Sunday. Again, something I'm not accustomed to. But we led by example, we learned by example, and we made new ways to do things. So in that respect, we were very innovative. The other thing that we had to deal with was, again, people getting into the hospital was not an option. Elective surgeries were canceled. People needed to get to their doctors or to see their doctors. And so technology and innovation there really helped us a lot, because we were able to hold these Zoom meetings with physicians, and people were able to continue to see their providers and to maintain some kind of continuity of care with their physicians. So that was some of our biggest resources. Thank you.
Thank you, Craig. Katie?
So I set up bi-weekly check-in meetings with each office manager and met with operations and various leadership members, really to focus on that time, that scheduled call, to discuss what was happening in their location and how it was affecting our colleagues and work streams. And it was a great way for me to brainstorm how to streamline our RTO processes and what we could do to support our colleagues. So it's so important for any of us to understand the culture of our organization, and if our efforts align with leadership team. The other big resources that I utilized throughout the pandemic was international SOS webinars, local government websites throughout the globe, shipping vendors, and law firm forum reports were a great way for me to review key trends that supported our RTO documentation manuals.
Thank you, Katie. It sounds like a common theme here is communication and working together, which I completely agree with. Moving on to the next question, when thinking about your experience throughout the pandemic professionally in your roles, can you speak to any challenges that you faced and how you may have overcome them? Maybe what you wish you would have known from day one of the pandemic? Amber, why don't you kick us off here?
Okay, there's so many things I wish I would have known. But I'd say one of the things that I'd like to say, the Port Authority has, tons of tech and infrastructure and the support staff that's needed. But smaller organizations, and I think back to my experience working with my church personally, of just trying to get them up and running and just realizing how big of the digital divide we do really have. Our church congregation has probably everybody, we have about 60% are over the age of 55, and ranging in inability in terms of tech, right? Some people, and a huge senior population that are like 80 plus, that, where church became something that they go to socially. This is where they see their friends. So they do everything revolves around church. And so not having that was really hard for a lot of people. And so really quickly thinking about how do you make sure that you're giving regular messaging and really just giving people hope, right? That things will get better, and trying to figure out how you can use different forms and make sure that people understand how to use social media. So I think for us, speaking just on a personal level and also professional, it's just trying to make sure that any communication that we're putting out there can reach the people that need it. And especially for our seniors and people with disabilities, where they have additional challenges that, sometimes emergency management programs aren't really set up to equip them with, really keeping that as the main focus, because if that worked out for them, it could hopefully work out for everybody else. So I think for me, it was putting those people first at the center of how we were communicating, what tools we were using, when we were putting out information, and just making things, as easy as possible.
Thanks, Amber. Mike, from your perspective?
One of the biggest takeaway, definitely something I wish I think I personally might not realize how much of disruption in the world supply chain there is, right? We all think that it's a connected world, right? It's an international commerce. We're still feeling it now, right? Even more so. And coming from someone with a field that responsibility tend to have a bit of a planning nature to it, right? Or sort of strategic structural approach. This is kind of a bit of a kryptonite to me, right? You know, forecasting the development of secure technology deployment. We don't even know if customer is coming back tomorrow, right? The world suddenly stopped, you know, on March, right? Everyone now go into pandemic mode, right? You know, it's a world that I never really experienced on this global lengthy scale, right? So challenges definitely changing that mindset, right? Adjusting and working with people, collaborating, using technology, right? And simply just a sense that you have to now have that pessimistic view of imperfection where there might be disruption on your project, for example, because some key people get COVID and they'll be out for 2 weeks, 3 weeks, whatever, right? Hopefully they're okay, right? It become your mindset become make sure they're okay first and that they're not, you know, right? They're not, the health is not in jeopardy. And you just have to accept this imperfection and just the rapid evolving landscape that it is, right? It is the fastest that it's so rapid, right? It's just hard to forecast anything, right? Plan anything.
Absolutely. Craig?
Thank you. I think we're still feeling challenges. Even, you know, my personal thought is that we are coming, I think, to that light at the end of the tunnel. At least I hope so. We've definitely gotten better at dealing with this, but we're still feeling some of those challenges. Staffing, for example, has been very, very difficult because of a number of reasons. Unfortunately, people getting sick. And again, Mike said it too, you're out for 2 weeks. And hopefully these people aren't in the hospital and they're home convalescing okay, but you know, people got sick. That hurt us. The ability of people to actually get to work. Transportation was an issue. One of the things that the city did for healthcare workers was issue these COVID-19 parking permits. If you can see that, I don't know where you can see that. In an attempt to help people be able to get to work. People need to work, they need to make money, they need to support their families. That's just the way that it is. But the staffing issues that we've had have been very difficult. And again, we ask people to come out of their day-to-day roles and step into alternative roles that they didn't usually do. They knew nothing about them. They were nervous, they were scared, and rightfully so. But that was a huge challenge. And again, the trend today is really communications. Is people don't know what to believe. They don't know who to listen to. Who's got the right information? Who's got the timeliest information? Are we getting it when we need it? Is it too late for it? So those are some of the challenges that we have faced and some of the challenges that we do continue to face. So I think the staffing is probably one of our biggest challenges at this time.
Thank you, Craig. Katie?
I look at challenges as opportunities. So as we pivoted to a remote work environment, I immediately focused on how I could market myself and my team's initiatives to successfully support the well-being of our colleagues. And our communications team helped me build an internal website that showcases our hospitality's team's missions and policies. I worked with our operations team on revisiting our marketing material, so it reflected how we plan to operate during the pandemic. And I also think being a silent leader has its advantages. You actively listen to others in meetings, check to see if you're talking too much in a meeting, and you address action points by the end of the meeting. So by collectively making note of your colleagues' ideas, your thoughtful approach is creating action plans, checklists, etc., something tangible to share in your next meeting. And it helps drive success for you and your team and fosters an inclusive environment. Memorializing decisions and key milestones so you can look back at what you and your team have achieved together, I think is really important as well.
Thank you, Katie. So next, we just wanted to ask each of you what your advice would be to young professionals entering into the emergency management space in, a variety of capacities. What would your top line thoughts be to share with them? Amber?
I have one thing, and this is what my mom has instilled in me, and it is don't be afraid to ask. Whatever that ask is. So if it's asking the question, asking for the job, asking for an internship, asking for opportunity, put it out there, all because all someone can say is yes or no. So that would be my advice to anybody, especially when you're younger and getting in your career, just trying to figure out, and don't be afraid. All they can say is yes or no. Can you teach me how to learn Spanish? Either you can or you can't. I would love to learn Spanish, but that's a whole nother conversation. But the key point is, that's how I got a lot of my jobs. I just went and asked, when I got into working in different fields, I was like, this is what I do. Is this something that is this something that I could start working on? Even when it comes to projects at work. So I think that's really important because all people can say is yes or no, and that's all.
You're absolutely right. Wise words. Mike?
Similar to what Amber is saying, in a different fashion, come out of that comfort zone and just step up and take on some leadership role that normally wouldn't happen, right? It's a pandemic in this case, right? As some of us already said, we are quite frankly all also learning as it goes. Step up, right? And don't be so self-conscious, right? You're only holding yourself back. It's not about you, right? Give it a try. If it doesn't work out, you learn something out of it, right? And no one will all forever remember that you did. It's you in a first tradition, like only you are worrying about how that you're embarrassed. No one really are thinking about it, right? So just go and try, give it a try, and step out of that comfort zone.
Thank you, Mike. Craig?
I would tell someone to never stop learning. It took a long time for me to understand that myself. And at 45 years old, I took the dive and went back to school full time. And I'm getting ready to graduate next year. And it's one of the hardest things I've done. Thank you. It's one of the hardest things I've done, being married, having 3 kids, working full time, having a part-time job. It's all worth it, and my boss always told me, dream big. So go for it. Why not go for it? And like Amber said, the worst they're going to do is say no. So why not take the dive? Go for it. But never stop learning. Take as much as you can out of it because you can apply it everywhere.
I'm feeling very inspired right now. Katie, over to you.
I would say be thoughtful with your approach on how you respond and interact with others, especially during the midst of business disruptions. Always be professional because it is a small world, and acknowledge your colleagues' ideas. Remember that your past work experiences and life experiences can be applied to your current role in your organization. All of them can.
Thank you, Katie.
And
So-
you know what, I just want to add on that, everything that you all have been saying, it's 100%. There's so much that we can learn. There's so much that, we can do to not only better ourselves, but push ourselves to, go above and beyond, and not to be afraid to network, go out there, find, talk to anyone that's related to your field. Especially when you're in emergency management or security, any type of fields like that, it can be very difficult to get your foot in the door. Getting recognized, getting getting your face shown and on a panel or something like that. But introducing yourself, not being afraid to go on LinkedIn, ask someone to connect with them. You never know what you will learn from each other. And I think one of the biggest takeaway too is that, especially nowadays, we're all practically virtual for the most part. Some of us have already gone back full time, which is great. But realizing and understanding that, paper processes and having to, stick with the 9-to-5 job might not be a thing anymore. That might just be in past. And one thing that a lot of employers are starting to learn, that we need to be flexible with our employees and how we work. And work-life balance is huge. A lot of our jobs are strenuous, 24/7, constantly on call. We're tired, we're not sleeping, we're not eating. That happens, and it comes with the positions that we are in our roles as emergency managers and security and communications, when your job relies heavily on you. And just remembering, taking that break, right? And understanding flexibility is important. And just to see what your workers need, right? Do they need mental health counseling? Do they need an extra vacation day or something like that? As simple as that. Or even better, hey, how are you doing? What are your thoughts right now? How is it affecting you? Age of COVID, there's been an increased amount of people who have developed anxiety and depression. And so it's so important to think about everyone's mental health at this time. And we're in a virtual world now, right? And so flexibility, again, just huge. Thank you. Katie, did you have any more questions?
So I figured I'd push it over to you now for any pre-submitted questions, audience Q&A questions. I know we have only 5 short minutes left, but I'll hand it over to you for now.
Okay, excellent. So audience, if you have any questions for any of our panels, please feel free to put them in the Q&A and we'll answer accordingly. All right, looks like we have a question. We'd love to hear your approaches to running your organization's business continuity plans. Do you have an internal version and external version? Excellent question. All right, which one? We'll let the panelists, y'all decide who wants to answer first.
Hi, so we do have business continuity plans in healthcare. They are evolving all the time. One of the issues that we face is because we are such a large organization, we have so many facilities, is that there's a local plan as well as the overarching plan. The local plan obviously is incredibly important, but the overarching plan is just as important. One of the challenges we face is making sure that we use the overarching plan as kind of a recipe, if you will, and trying to make sure that everyone's on the same page, because again, one of the issues that we always face is consistency. So, but yeah, it's an internal plan because it's part of the hospital, but we do work across each level of the hospital and each of the hospitals together collectively to bring it all together, if that helps to answer the question.
Excellent. Anyone want to add on? Okay, we have another question that just came in. Is business continuity plan the same as emergency management plan? Anyone want to answer that? I would say, depending on how you define both, business continuity plans are very focused on your current continuity of operations. If something were to happen to your business or your, wherever you are working, how are you going to rebuild that business, right? Or that unit? Or let's just say your director's out of the office because they're sick or they're on vacation. Who will succeed after them in the event something were to happen? If, say, you have an LA office and the LA office goes down because of wildfires or whatever it may be, that's kind of drastic. But how would you manage those functions within LA? Now, emergency management plan can go in different ways. They're emergency response plans, right? Emergency response plans are more of a tactical, operational type of plan that will determine how you respond to certain emergencies, such as a hurricane. If there's a hurricane, okay, what do I need to do? I need to make sure that, one, my employees are safe, send out mass notifications to all my employees to let them know that they should probably stay home. Or another thing might be that we're going to have to do damage assessments, right? Who is part of my incident command chain and what do we do? So it's a little different, but emergency management basically encompasses BCPs and everything like that as well. Another question. Seems like this isn't, oh, no, sorry. If a company doesn't have an emergency plan, how do you approach your managers to discuss putting together a plan?
I'd say just, like we didn't have a plan for our church, right? And so it's just like getting all the leaders together to make them see like what are the things that we need to do to keep things going. And then everybody sort of fell into line that way because they had to deal with an emergency. Would have been way better if we had done this 6 months ago before the pandemic, but that just wasn't the case. So figuring out what resources that you have, and just doing things that are as a regular backup. Like one of the things we realized that everything was on site. Nothing was in a cloud. Nothing was being able to be used off site. So those are some of the things that people can take now and figure out where you have a lot of those, pain points. And that, takes very quickly to do. What do we have? Can everybody access the phone systems that we have? Who are our main contacts? Who are the vendors that we need to get in contact with? So if you have and work with your office manager knows everything, they're a very valuable person in the agency and they'll know, or your company or whatever, to figure out what your day-to-day needs are.
Thank you, Amber. So we just have one more quick question. I think this is just a really good one that we should quickly address, and then we can close up. Since the pandemic, basically, it doesn't seem like it's ending soon. How are you adjusting to things like boosters and new mandates and weekly testing?
So I'll start. So as a state agency, we're mandated to either be vaccinated or undergo weekly testing, but we're by state agency because it's New York, New Jersey. So, just really working to educate our staff and make sure that they know what to do and have the ability to take advantage of every opportunity.
In healthcare, we face similar challenges. It's, every healthcare provider in New York State was mandated to be vaccinated. One of the things we did was launch an education campaign and try to stress the importance of the vaccinations. It's hard. We can't make people do what they don't want to do. And I understand that they have their own points of view, and they'll vary with others, and that's fine. But we do have a job to do. We have a duty to provide for our patients. So we need to make sure that we can maintain in an appropriate way.
We addressed some of these various points on town halls. We knew that it was important to follow local government guidelines, but also to take a firm stance on some of these things too, because you're collectively working together to get back to returning to operations.
All right, well, thank you so much. We're pretty much out of time, a little bit over time. But I want first, thank you so much to WIIS Global and WIIS New York for making this event possible. And once again, if anyone's interested in joining WIIS or the Emergency Management Task Force, please email WIISNewYork@WIISglobal.org. For more information, visit WIISglobal.org. And thank you so much, panelists, and a big thank you to all of you out there for taking the time to tune into this event. We hope you enjoy the webinar, and please have a great rest of your day, and I hope to see you next time. Thank you.
Thank you.
Thank you, everyone.
Thank you, everyone, for joining.
Thank you very much. Have a great day.
Bye. Thank you.
Bye.